Hi from Fireside Farm Fit. I just wanted to do a quick video as I've had a few riders come in with shoulder pain this week. And so when we look at the shoulder, we want to think about that it's a ball and socket joint, right? And that ball is meant to sit in the center of that socket. What I often find common with riders is that ball starts to shift forward in that socket and that shoulder becomes rounded. And that can happen for a few reasons. One, that pectoralis major and minor can become tight, as well as your subscapularis, which is a muscle that sits deep in that shoulder blade and wraps around. When those are tight, it's pulling that shoulder forward. And then we can get some tightness in that posterior capsule of the shoulder, as well as general weakness in all of these posterior rotator cuff and scapular muscles. The further forward that ball sits in that socket, the tighter the area is in that shoulder, and it can be really likely to pinch when you go to reach or lift overhead or use that shoulder. So a few things that we can do for that: we can come in and do some manual therapy to stretch that posterior capsule, some joint mobilizations. We can work on some massage and loosening up of those pectoralis and subscapularis muscles. And then we can come in with some re-education to lengthen that front of the shoulder and strengthen the back of the shoulder. We also like to look at how that thoracic mobility is working, as that affects how the shoulder and shoulder blade works, and then examine a little bit of the neck and those first ribs as well. Hope that helps.